Hello everyone. Welcome to Lump Lecture Series featuring wrist and ankle acupuncture, presented by Lump AcuWellness Foundation Inc. Wrist and ankle acupuncture is a relatively new acupuncture technique that was invented in 1975 by Professor Xin-Shu Zhang in Shanghai, China. It is a special acupuncture technique that involves acupuncture performance from complicated to simple, choosing points from more to fewer, insertion from deep to shallow, and stimulation from strong to gentle. This technique is convenient, safe, easy to understand, easy to perform, and it has very good clinical results. Wrist and ankle acupuncture therapy uses filiform needles to stimulate subcutaneous tissues of the areas around the wrist and ankle to treat diseases of the whole body. Depending on the area of disease manifestation along the 6 longitudinal areas of the body, one of the 12 points is chosen around the wrist and ankle. The wrist is used for disease above the diaphragm, and the ankle for disease below the diaphragm. The point is stimulated using a filiform needle in the subcutaneous tissue. However, this technique does not require that the patient have a strong sensation from needling or that the patient feel the chi. The relationship between the wrist and ankle points with the meridians. The subcutaneous regions are the parts of the meridians located in the superficial layers of the body, based on the 12 regular meridians. Wrist and ankle acupuncture therapy divides the body into 6 longitudinal areas, similar to the 12 meridians of the body. For example, the Shaoyin meridian is located at the middle of the body, which is similar to Area 1 on wrist and ankle acupuncture system. From anterior to posterior, the order of the meridians is as follows: Shaoyin, Juyin, Taiyin, Yangming, Shaoyang, and Taiyang. This is similar to longitudinal areas 1 through 6. Upper areas 1, 2, and 3 follow the yin aspect and are equal to the 3 hand yin meridians. Upper areas 4, 5, and 6 follow the yang aspect of the arm and are equal to the 3 yang hand meridians. Lower areas 1 through 6 also are equivalent to the 3-foot yin and the 3-foot yang meridians. The hand 3 yin and 3 yang meridians travel along the wrist, and the foot 3 yin and 3 yang meridians travel along the ankle. Also, specific points around the wrist and ankle, such as small intestine 3, Ho Shi, Sanjiao 5, Wai Guan, pericardium 6, Nei Guan, lung 7, Lie Che, urinary bladder 62, Shen Mai, gallbladder 41, Zhu Lin Qi, kidney 6, Chao Hai, and spleen 4, Kung Sun. Connect with the Du, Yang Wei, Yin Wei, Ren, Yang Chao, Tai, Yin Chao, and Chong meridians. The wrist and ankle areas have a close relationship with the meridians and Zangfu organs. The relationship between wrist and ankle acupuncture with the 5 Zang organs. The 6 longitudinal areas are divided at the diaphragm, with the upper area containing the heart and lung, and the lower area containing the liver, spleen, and kidney. This is the same as the 6 hand meridians and the 6-foot meridians with relation to the organs. Wrist and ankle acupuncture has a close relationship with the whole body, as well as the 5 Zhang and 6-Fu organs. Also, the wrist and ankle acupuncture points have a total of 12 stimulation points, all located around the wrist and ankles, which are the root areas of the meridian system and can treat diseases of the whole body. The 12 stimulation points are all distributed along the meridians in almost the same areas as some luo points or passing close to the luo points. Superficial stimulation of the subcutaneous areas can harmonize local meridian qi and blood, indirectly connecting the Zhangfu to treat diseases of the whole body. The principle of treating upper body disease from points in the lower body. The 4 extremities are the root of the body. Many important effective points are located below the knee and elbow area and through their meridian connections. Wrist and ankle acupuncture matches the principle of treating upper body disease by choosing points on the lower or distal area of the body. Treating the protective qi. Wrist and ankle acupuncture stimulates the subcutaneous tissue, which is a superficial layer of the body. This technique chooses protective qi as a treatment target without damage to or stimulation of nutritive qi. This theory has been since the time of the ancient book Nanjing. Insert the needle to the protective level without damaging the nutritive level. Archery to target. Wrist and ankle acupuncture also focuses on bringing qi directly to the diseased area. Wrist and ankle acupuncture requires inserting the needle toward the body's center direction on a superficial layer, which activates the body's energy toward the disease manifestation area to treat the disease. Work on nerve endings with superficial insertion. Wrist and ankle techniques are adopted from ancient techniques of superficial insertion, such as Zhi Chu and Fu Shu. This technique works on the superficial layer of the skin without insertion into the muscle layer. The needle insertions follow the 6 longitudinal areas of the body and cover a rather large area from the spinal nerves and 12 cutaneous regions. It has good results based on sensitive reactions of nerve endings. Characteristics of wrist and ankle acupuncture. Wrist and ankle acupuncture is easy to learn because there are only a few points. There are only 12 total points on the wrist and ankle to treat whole body diseases. Therefore, it is easy to understand and remember point locations. The patient needs to expose only the local wrist and ankle areas for needle insertion, making this treatment easy to perform. There are no time or environmental limits to performing this technique. For wrist and ankle acupuncture techniques, the needles are inserted into the superficial layers of the skin in the subcutaneous tissues. At this layer, the muscles and nerves are easy to avoid, resulting in a painless treatment. In addition to the initial insertion through the skin, the patient has a very minor sensation without pain once the needles are in the correct layer of skin. Wrist and ankle acupuncture is safe to use because there are no important internal organs and no large blood vessels or nerves in these areas. Therefore, there is no risk of any needling accident. Seldom are there incidents of fainting in the clinic when using wrist and ankle acupuncture. Wrist and ankle acupuncture often produces immediate effects in the patient when inserting the needles in the correct layer of tissues. Working very close to the superficial layers of the skin, where many nerve endings are distributed, results in a quick response to the treatment. Wrist and ankle acupuncture provide long-term effects. Due to the superficial insertion of the needles, this treatment does not limit the patient's physical activities. The patient can retain the needles for a few hours or a few days while still carrying out his or her normal activities. There are a wide range of indications for wrist and ankle acupuncture. Due to its remarkably effective and fast results, wrist and ankle acupuncture is preferred for painful conditions such as headaches, toothaches, joint and nerve pain, menstrual pain, and post-surgical pain. In addition, it is useful for sinusitis, asthma, skin conditions, and hysteria. It is sometimes used to treat high blood pressure, stroke, paralysis due to strokes, and insomnia. The wrist and ankle acupuncture system. Now we go to area locations and indications. The divisional lines of the body. There are 5 divisional lines of the body. Anterior midline. A line located at the center of the front side of the body that goes from the mid-sagittal line to the suprapubic bone. Posterior midline. A line located at the center of the back of the body, along the spine, that goes from the mid-sagittal line to the end of the coccyx bone. Transverse line. A horizontal line drawn from the end of the sternum to the costal arch, traveling to the vertebral spine, that is used to divide the body into upper and lower parts. Brachiotruncal line. From the upper border of the deltoid muscle to the axillary area. This circular line separates the arms from the body trunk. Femorotruncal line. From the groin to the iliac crest, this circular line separates the legs from the body trunk. The mid-sagittal plane divides the human body into left and right. On each side, divide the body further with 6 longitudinal lines, creating 6 bilateral areas. Area 1. Central area that is bilateral from the anterior midline that includes the forehead, eye, nose, tongue, esophagus, trachea, heart, abdomen, and perineum. Area 2. Located bilateral to Area 1. Area 2 includes the temporal region of the head, cheek area, molar teeth, mandibular area, breasts, lungs, liver, costal areas, hypochondriac area, and lateral abdominal area. Area 3 is located bilaterally to Area 2 on the front lateral side of the body. Area 3 covers a narrow vertical area along the anterior border of the ear and the anterior border of the axilla. Area 4 is located at the intersection of the front and back of the body. Area 4 is the area from the vertex 220 biwheel down to the earlobe and directly below the axilla. Area 5, located bilaterally on the dorsal side of the body, on the opposite side of the body as Area 2. Area 5 includes the posterior aspect of the temples, the lateral aspect of the neck, and the lower part of the shoulders. Area 6, central area bilateral from the posterior midline, on the opposite side of the body as Area 1. Includes the occipital area of the head, neck, back of the neck, and spinal cord. Upper and lower body trunk. A horizontal line is now drawn from the end of the sternum to the costal arch. The connecting point is at both sides of the ribs. This line divides the upper and lower parts of the body. The areas above this line make up upper areas 1 through 6. The areas below this line make up lower areas 1 through 6. The areas are named according to location, including left or right, upper or lower, and 1 through 6. For example, the areas may be called upper right 4 with a designated nomenclature as R4, or lower left 3 as L3. The four extremities area. The areas are located with the limbs in an externally rotated position, so that the palmar sides of the hands are facing forward, and the medial leg is also forward. The ulnar part of the arm and between the two legs will be the middle line, and the forelimbs are divided into 6 zones as in the trunk. In this position, the longitudinal lines of the body are all in a straight vertical line. The following is the designated nomenclature for wrist and ankle acupuncture. L for left side, R for right side, U upper zone, D lower zone. The arrow pointing upward or the arrow pointing downward. The direction the needle tip is pointing. All needle tips are directed proximally unless the arrow pointing downward is marked. L1, upper 1 on the left side. R6, lower 6 on the right side. LR4, 5, upper 4 and upper 5 on both sides. L1, the arrow pointing downwards, R1, lower 1 on the left side with tip of the needle pointing distally, and upper 1 on the right side with the tip of the needle pointing proximally. LR1 and 1, upper 1 on both sides and lower 1 on both sides. Point locations and indications. Let's start with the wrist points. The wrist points are all located about 2 tsuen above the transverse crease of the wrist, which represents the upper body. There are a total of 6 points. Upper 1, location on the ulnar side of the anterior forearm, in the depression between the ulna and the tendon of the flexor carpi ulnaris muscle. Indications of upper 1: frontal headache, diseases of the eyes and nose, trigeminal neuralgia, facial edema, toothache, hypertension, heart disease, chills, night sweats, insomnia, sore throat, stomach pain, bronchitis, nausea, hiccups, dizziness, vertigo, and hysteria. Upper 2. Location: in the center of the anterior distal forearm, between the tendons of the palmaris longus and flexor carpi radialis muscles. Indications of upper 2: temporal headache, molar toothache, chest pain, stuffy chest, asthma, palmar pain, numbness of the fingers, and discontinued lactation. Upper 3. Location: on the anterior forearm in the depression on the lateral side of the radial artery between the radius and the radial artery. Indications of upper 3: hypertension, pain in the side of the chest and abdomen, migraine headache, pain of the anterior lateral aspect of the shoulder, and pain of the thumb. Upper 4. Location: with the palm facing the body on the lateral border of the radius. Indications of upper 4: pain in the vertex, tinnitus, deafness, disorders of the temporomandibular joint, frozen shoulder, and pain in the chest below the armpit. Upper 5. Location: on the dorsal aspect of the wrist. This point is located between the radius and the ulna bones. Indications of upper 5: temporal headache, shoulder pain, frozen shoulder, pain and numbness or paralysis of the upper limbs, elbow pain, pain in the wrist and fingers, and stiff neck. Upper 6. Location: on the dorsal aspect of the forearm on the ulnar side of the ulna. Indications: occipital pain and pain around the cervical and thoracic spine. Now let's go to the ankle points. There are a total of 6 ankle points located about 3 tsun above the medial and lateral malleolus, around the level of spleen 6, San Yin Jiao, from the medial aspect of the calcaneal tendon to the lateral border of the calcaneal tendon. Lower 1. Location: on the medial aspect, on the distal portion of the leg, at the medial border of the calcaneal tendon. Indications: used to treat distending pain in the upper abdomen, pain around the navel, dysmenorrhea, leukorrhea, genital itching, and heel pain. Lower 2. Location: on the medial aspect of the distal portion of the leg and posterior to the border of the tibia. Indications for lower 2: used to treat pain in the hypochondriac area and the side of the abdomen. Lower 3. Location: 1 centimeter medial to the anterior crest of the tibia. Indications: used to treat pain in the medial aspect of the knee. Lower 4. Location: between the tibia and fibula. Indications: used to treat knee pain, numbness and paralysis of the lower limbs, and toe pain. Lower 5 is located at the posterior border of the fibula. Indications: used to treat hip pain, sprained ankle, and pain in the lateral side of the leg. Lower 6. Location on the lateral border of the calcaneal tendon. Indications used to treat back pain, sciatica, spasm of the gastrocnemius muscles, and anterior sole pain. Wrist and ankle acupuncture therapy. Point selection. Wrist and ankle acupuncture therapy uses points based on the area of the disease. For disease manifesting above the diaphragm, use the wrist points. For disease below the diaphragm, use the ankle points. The ankle and wrist points are used on the same side of the body as the disease. For a temporal headache located on the left side, use upper 2 on the left wrist. If the disease is located bilaterally on the body, needle the points bilaterally. For example, if a headache were located medially on the forehead, upper 1 would be stimulated bilaterally. For disease that is located on both the anterior and posterior parts of the body, the point should be used on both sides of the wrist and ankle. For example, use upper 2 and upper 5 at the same time. For motor disorders of the forelimbs or to reduce excess sensations, use upper 5 or 6 for the arms or lower 5 or 6 for the legs. For whole body disorders or diseases that cannot be located in a specific area, such as a skin disorder, insomnia, or mental disorders, upper 1 may be used bilaterally. For a patient with several diseases occurring in the body at the same time, it is best to treat the most severe or the acute disease first. For painful conditions, the pain should be treated before any chronic disease is addressed. Important factors of point selection. Choosing the right point is an essential part of wrist and ankle acupuncture. It is based on two important factors: manifestation area of the disease, pressure point. Choosing the correct wrist and ankle acupuncture points is based on a combination of clinical conditions and the presence of pressure points in the body. Pressure points are sensitive spots on the surface of the body. They usually indicate dull pain, sharp pain, or stiffness. It is a local manifestation of the body's abnormal condition. Usually, the pressure point is due to local swelling, spasm contractions, and edema from skin, vessels, nerves, muscles, joints, bones, and internal organs, causing circulation stagnation. The occurrence of the pressure point can be a functional disorder. The muscle spasm can usually be seen when the body sensitivity is increased. The pressure point will show an increase in degree of pain. After treatment, when body sensitivity decreases, the pressure point will reduce as well. Pressure points can occur with some diseases, which show manifestation of the pain. Also, they can be seen with some diseases without pain, such as vertigo or sleep disorders. Pressure points can occur with certain diseases at multiple locations, such as sciatic nerve pain. There are multiple pressure points along the sciatic nerve distribution. When a patient has a digestive ulcer, there is a pressure point on the left upper abdomen, and sometimes pressure points can occur at the fifth thoracic vertebra, on the back toward either the right or the left. In the clinic, when treating disease by using wrist and ankle acupuncture, focus on the pressure point first. Choose points based on where the pressure point occurs. Pressure points can also be used for the evaluation of treatment effectiveness. When the patient is feeling better after acupuncture treatment, the pressure point should be smaller or less painful. Two common points routinely used to check body disease are urinary bladder 10, Tian Chu, and gallbladder 21, Qian Qing. Urinary bladder 10 is located in area 5, between the second cervical vertebra and the earlobes, in the depression on the lateral aspect of the trapezius muscle. It is the most common pressure point of upper body disease. Gallbladder 21 is located in area 5, midway between Du 14, Ta Chui, and the highest point of the shoulder. It is commonly used along with urinary bladder 10. These 2 points will occur in the most painful diseases. So, use these points in routine examination. In the clinic, we also need to check for other pressure points based on the patient's clinical condition. Indications. Wrist and ankle acupuncture can have excellent results for pain control, for conditions such as headache, toothache, dysmenorrhea, and post-surgical pain. For some conditions, such as runny or congested nose, excess saliva, asthma, itchy skin, leukorrhea, hysteria, hypertension, post-stroke rehabilitation, and insomnia, it also has good results. Techniques. Use 34 to 38 gauge, 1.5 cun long filiform needles. Have the patient in a position that is comfortable for the patient. Insert the needle at a 5 to 15 degree angle with the needle tip directed toward the diseased area. Usually the stimulation is directed toward the heart. However, if the disease is in the hands or feet, have the needle tip directed toward the hands or feet. Use the pressing hand to hold and stretch or pinch the skin with the thumb of the puncture hand under the needle. Use the index and middle fingers to hold the needle handle and support the needle with the ring and little fingers. You can also use the needle with a tube for stable insertion. Make a rapid insertion into the skin at about 30 angle first, and then slowly insert the needle further into the subcutaneous tissues at a 5 to 15 degree angle as a transverse running insertion. The practitioner should feel the sensation change from resistant to loose with a soft sensation under the needle. If the patient has a sensation of heaviness, numbness, soreness or tingling, or a general cheat sensation, this is an indication that the needle has been inserted too deeply into the muscle layer and should be relocated to the subcutaneous layer by pulling back and adjusting the needle angle and reinserting. Insert up to 1.4 cun in length. The needle is usually retained for 20 to 30 minutes without stimulating the needles. For diseases that are more severe, the needle may be retained longer. The withdrawal technique should be rapid, and pressure should be applied with a clean cotton ball to prevent bleeding. The treatment course consists of 10 treatments, one every other day. For acute conditions, needling may be done twice daily. Needles may also be left inserted for up to 2 days, taking precautions to prevent needle sensation. The following signs show that the tip of the needle has reached the ideal layer of tissue. The body of the needle should lie flat on the skin surface without any angle. The practitioner should not feel any resistance when gently pushing the needle forward. If wrinkles are visible in the skin when the needle is being advanced, this is usually an indication that the needle is still in the dermal layer. The patient should feel no pain when the needle is being pushed forward. If the patient experiences soreness, numbness, distension, heaviness, or pain, this often indicates that the tip of the needle may have been inserted too deeply. The patient may experience sharp pain if the needle is inserted too superficially or if the needle is inserted into the wall of a blood vessel. It is important to stimulate the disease manifestation area while retaining the needle around the wrist and ankle areas. Practitioners can use massage, moxibustion, cutaneous needles, or cupping along the 6 longitudinal areas of the body where the disease is located or manifested. By inserting the needle around the wrist and ankle areas to bring the energy to the target area, these techniques will cause a corresponding energy reaction and will usually achieve better results. For wrist and ankle acupuncture, urinary bladder 10 and gallbladder 21 are routine pressure points selected during the basic examination to confirm treatment methods. In the clinic, you can also combine them with any other area painful spots such as ashi points. The evaluation of treatment results is based on the patient's feelings of changes after treatment or the disappearance of the pressure pain point. When doing wrist and ankle acupuncture, it is required to stimulate the area without eliciting a chi sensation. Also, the patient will have better results with passive movements such as cupping, moxibustion, or massage performed at the target diseased area. Although chi is not elicited at the insertion area, it is directed elsewhere. Eliciting chi without needle sensation is the most important characteristic of wrist and ankle acupuncture. Needle sensation and direction should be directed toward the heart, unless the patient has a hand or foot disease. In these cases, the needle should point to the end of the extremities. This is because the needle reaction and result have a relationship with the needle direction. One of the most important features of wrist and ankle acupuncture is that the patient's range of physical movement is not limited while the needles are retained. Performing physical activities creates a stimulation feedback to the needles, making the treatment more effective. Wrist and ankle stimulation is very shallow. It works on the nerve endings so that the body has a very strong reaction and results are achieved immediately. Wrist and ankle acupuncture uses only a few selected points, but the stimulation area is large. The stimulation area is a vertical line, so the results are obvious. Wrist and ankle stimulation points should be selected on the same side as the disease. Thinner and softer needles such as 34 to 38 gauge needles should be selected for wrist and ankle acupuncture. This will reduce the pain as they are inserted into the body. Softer needles also enter the subcutaneous layer of the skin more easily. When inserting the needle, the practitioner should feel a soft sensation of resistance. This usually indicates that the needle is in the correct layer of the subcutaneous tissue. The patient should be able to walk or use his or her hands after insertion is finished. If the patient still experiences needle sensation or pain, it indicates that the needles are not in the correct layer. 5 possibilities need to be considered. Needle insertion is too shallow. When the needle insertion is too shallow above the subcutaneous layer, the patient will experience sharp pain. The practitioner will feel resistance and notice that the patient's skin looks like the skin of an orange, forming wrinkles along the direction of the needling. Needle insertion is too deep. The needles are inserted at the distal areas of the four extremities in wrist and ankle acupuncture. The distal areas are thin and small, but the proximal areas are thick and rather large. Although wrist and ankle acupuncture require shallow insertion, it is very easy to insert too deeply. The patient will feel soreness and pain, which will affect the treatment results. In this case, readjust the needle to the correct layer. Needle direction is wrong. Wrist and ankle acupuncture divides the body into 6 longitudinal areas. The direction of the needle should match the direction of the 6 longitudinal areas. Missing the correct direction will affect the treatment results. Sometimes the practitioner might find that pain spots have moved after inserting the needles. In this case, redirect the needle toward the new painful area. Needle length is incorrect. The needle length required is 1.3 to 1.4 tsun in order to cover more area to treat the pain more effectively. However, in recent years, more practitioners prefer to use shorter needles that are 1 tsun in length to prevent the needles from being inserted too deeply. Physical reactions occur. Sometimes the patient experiences dizziness and palpitations during the treatment. This is an indication that the needle may be inserted too deeply. The practitioner should readjust the needle and the symptoms will disappear. Adjusting the needle is a very important step in wrist and ankle acupuncture. If the patient feels a chi sensation when the practitioner inserts the needles, adjust the needle immediately to make the chi sensation go away. Most dysfunctional conditions, diseases, and nervous system pain have better results with wrist and ankle acupuncture. This is a good reference so that the practitioner can make the decision of what type of microacupuncture system to choose. There are a number of vessels under the subcutaneous tissues. When inserting the needles, it is important to avoid needling into the vessels. If a vessel is located in the point, the needle may be inserted slightly above or below the point, based on the principle of needling on the meridian, but not exactly on the point. The insertion should be on the superficial cutaneous level and never too deep. Wrist and ankle acupuncture needles are inserted around the end of the extremities and are exposed to the environment. The needles are often left in the points for a few hours or a few days while the patient continues his or her normal physical activities, so the needle areas can easily get infected. Therefore, insert needles following clean needle techniques and follow up carefully to prevent infection. Thank you very much for your attention. See you on our next videos.